Okay, good morning, good afternoon, or good evening to all of you. Thank you very much for joining our, as you will see, our 10th full meeting of the HPV Prevention and Control Board. I think it's important, so we have a Zoom meeting. You can see each other who is participating. You can use the chat function to chat also personally with the participants. So I just want to go through the participants list. I know that we don't have time for a lot of interaction with all the participants, but if you're present and I'll call your name, you can switch on your camera and just say hello, your name, institute and country, and we can move on, but at least you will know then who is in the meeting room. So when I'll go alphabetically, the first participant, Agapa Hiroki, but I just get the signal that he's not yet joined the meeting. And then we also have Maribel Almonte.
So good morning, I'm Maribel Almonte from the International Agency for Research on Cancer in Lyon, France. Thank you.
Thank you. Then we have Mark Arben, who was not joining us yet. Then we have Narendra Arore, an advisor of the board. He also is not yet present. Then we have our rapporteur, Mark Bai.
Good morning. Well, hello to all. This is Mark. I'm from P95 and I'll make the report.
Thank you. Then we have Armando Beana. You can correct the pronunciation, because I know I'm quite terrible in pronouncing the names.
Yeah, hello everyone. Armando Baena from the International Agency for Research on Cancer. Same Maribel's team.
Okay, nice to have you on board. And then we have Partha Basu, also from YARC, who not yet joined us. Then I know that Jacobo Bossano is online.
Yeah, so good morning, everyone, or good evening. I'm Jacopo Bossano, again from IARC.
Nice to see you, Jacobo. Then we have Angela Beccini. And she informed me that she would only participate in starting from the afternoon. And then we have Bernd Benninghoff.
Hello, everyone, and good morning. Bernd Benninghoff, GSK.
Nice to see you, Bernd. Then we have Paul Bloom, who did not yet join us. And then we have from Italy, Sara Boccalini.
Good morning. I'm Sara Boccalini, University of Florence, Italy.
Nice to see you again, Sara.
Hi.
We have Paolo Bonanni.
Yes, hello. I'm driving. I'm Paolo Bonanni from Italy, a member of the board. Just for half an hour, then I will be in front of my computer. Thank you very much.
Okay, be careful, Paolo. We are not insured for accidents while joining our meeting. And then we have Xavier.
Good morning, everyone. This is Xavier Bosch from the Catalan Institute of Oncology and the Open University of Catalonia.
Good morning.
Okay.
Hello, Bernd.
Then we have Noel Brewer.
Good morning, Noel Brewer from the University of North Carolina, the United States.
Thank you for joining us so early. I don't know if Nathalie Broutet is joining, not yet. And then we have from ECO on the list, Laia Bruni, but also she will join later.
I'm here.
Online. Yes,
I'm here.
so.
Okay, so this is Laia Bruni from Barcelona, Institut Catalan of Oncology.
Thank you for joining us. Then we have Emily Berger.
Yeah, hi, everyone. Emily Berger, an associate professor at the University of Oslo in Norway. And then I have a joint appointment with Dr. Jane Kim's cervical and HPV modeling team at Harvard School of Public Health.
Okay, thank you for joining. And then we have Ado Miapa Bawaka.
Hello, good morning. This is Ado Bawaka. I'm working with WHO at the regional sub-regional office in West Africa. I'm in charge of immunization in WHO for West Africa countries. Thank you for inviting us.
Joining. Then we have Francesca Carossi, who is not yet online. Then I'm sure that Carlos Castro is there.
Hello, good morning. I would like to share my Colombian coffee with you guys. I'm the medical director of the Colombian League Against Cancer. It's a pleasure to be here. Thanks.
Okay, thank you. Then we have Alessandra Castanon.
Good morning, everybody. I'm Alex Castañón at King's College London.
Good morning. And then we have Elaine Chouriat from Johns Hopkins, who's not yet online, or from GPAGO, sorry. We have Victoria Xu, who also registered. And then we have Michael Chung, who also registered, but not yet logged in. Lindsay Connor from Scotland. Jack Cusick is on my list for the afternoon, so he will join later. Lucia de Oliveira apologized yesterday evening. Then we have Sylvia de San Jose. Good morning.
Good morning, everybody. Silvia de San Jose from the National Cancer Institute from the US, but living in Barcelona.
Good morning,
nice to see you, all of you.
And then we have Owen Demke from Chai, who also has not yet logged in. I saw Lynette Denis. Good morning, Lynette.
Good morning. Thank you very much. I am from the University of Cape Town, South Africa.
Nice to see you. Then we have Kanan Desai from the NIH. Yeah, I have Xenia who gives a thumb up or a thumb down, and that's a thumb down, so we move on. Evie Dubé is also not yet joined. Hannah Elassefar also is not hooked up. And then we have Dan Ehrlich from Johns Hopkins, but it's quite early for the US, we know. Eduardo Franco, also not yet there. But I did see Susanna Garland.
Yes, hello everybody, I'm here. Good evening. I'm from University of Melbourne and the Royal Women's Hospital in Melbourne, Australia.
Thank you for joining us so late. And then we have Anna Giuliano, an advisor who also has to connect later on. Murat Gultekin also will join us later. And Sharon Hanley also will share us, be present later on. My colleague Gret Hendricks is at another meeting for the moment. Then we have Taylor Holroyd from Johns Hopkins who registered. Lisa Huang will speak later in the program tomorrow. Mary Carol Jennings from GPAGO also registered. And then we have Mark Kane from Seattle, who is also not yet present. I think Emily Carafelikis is has already joined us. Good morning, Emily.
Hi, everyone. This is Emily Carafelikis from the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine.
Nice to see you. Then we have Melvin Cohn.
Good morning, Mel Cohn from MSD Merck.
Nice to see you. Then we have Mira Kujuhovara.
Hi, good morning. I'm Mira Kuzhkarova from Bulgaria. I'm member of HPV Prevention and Control Board, and I'm professor on epidemiology in Bulgaria. Thank you.
Hello, and then we have Amy Kramer as a speaker. She will join later. Then we have Suzanne Berger from Denmark.
Hello, everybody. I'm Suzanne Quijaker from the Danish Cancer Society Research Center in Copenhagen, Denmark. Nice to see you all.
Also registered is Somesh Kumar. He will share a session later on. Heidi Larson, she will give a presentation this afternoon. And Rupali Limai from Johns Hopkins, also registered, but has not yet connected. And then we have Irene Mann from the Netherlands.
Hello,
Good
everyone.
morning.
I'm Irene Mann from the International Agency for Research on Cancer. So I'm actually now in Lyon.
Okay. And then Mauricio Mazza.
Good morning, everyone. My name is Mauricio Massa. I'm Executive Director for Basic Health International, and I'm currently in El Salvador.
Okay, then I have Xenia Mikula.
Hi, my name is Xenia Mikula, and I work at the University of Antwerp and mainly for the HPV board. So hi, everybody.
And then there's Chris Morgan from GPAGO also. Not yet joined. Andrea Moscadelli.
Hello, everyone. I am Andrea Muscadelli from Florence, Italy, and thank you for the opportunity of joining you today.
Thank you for joining. And then we have Ludmila Mosina.
Good morning, everybody. Glad to see you. I am from WHO Regional Office for Europe, and I'm glad to be here with you today. Thank you.
Thank you. And then we have Nubia Munoz.
Good morning, everyone. I am a Colombian epidemiologist at IRC, living in Lyon.
Okay, and I have Kirtani Muraladaran, who will join later on. Then we have Tanya Myers, who will speak this afternoon, but is not yet online. And then we have Anne-Laure Page from WHO, who will join later. And then we have Mario Poljak.
Yes, hi everyone. I'm Mario Poljak from University of Ljubljana, Slovenia. Nice to see you all.
Thank you. And then we have Irena Prat. And then we have Miriam Reuschenbach.
Yeah, thank you. Good morning. I'm Miriam Reuschenbach from MSD. I'm looking forward to the meeting.
Then we have Svetlana Rokovskaya.
I'm Svetlana Rogovskaya from Russian Association for Genital Infection and Neoplasia, professor of gynecology. Hi, everyone.
Thank you for joining, Svetlana. Then we have Chantal Sauvignon from Canada.
Hi, everybody. I'll open my camera when I will be presenting a bit later here. So I'm Chantal Sauvageau from Quebec Public Health Institute in the nice province of Quebec in Canada, 5 a.m. in the morning. So hi, everybody.
Thank you for joining so early. Then we have Kate Sims, who is not yet online. Then we have Margaret Stanley.
Good morning, everyone. I'm Margaret Stanley, and I come from Cambridge.
Thank you. Yeah, I just heard that Kate Sims just joined us. Then we also have Gwen Stevens from Cephite, South Africa.
Good morning, everybody. Gwen Stevens from Cepheid Medical Scientific Affairs team based in South Africa.
Okay, and then we have Christian Sturkik, who's not yet joined. Julie Thurold will join us later as a speaker. I know Mette Tranberg will join us tomorrow. My colleague Sarah Valk also will join us later. Then we have Sandra van Dijk from the Netherlands. We have our head of the unit, Pierre van Dam, who is very busy also with COVID-related things. We have Severin van Keer, who is helping us with the presentations.
Hello. Oh.
Yeah. Yeah. So she's in the same room as us. We have Cherian Varghese. He's not yet there from WHO. So myself, then there's my colleague Nayab Wahid.
Hello, everyone.
And then Oliver Wildanger.
Good morning, everyone. This is Oliver Wildanger from Roche Diagnostics.
Okay, and then Joanne Yarwood will join us later. Also, Wu Yu Ling is not yet. And then from UNICEF, Oya Seren Afar is present. Good morning, Oya. Okay, so thank you all for joining us so early. Okay, I just hear that Hiroki Abaka has joined us, so maybe just say hello. And also Paul Bloom joined us. So if you would
Good morning.
say hello.
It's a pleasure to be with you, Paul Bloom, WHO Geneva, and Hiroki also from WHO Geneva. Thank you.
Okay, thank you. So thank you all. So I think it's nice to know who's around the table today, because we do hope, we know that's online, but it's real time, this meeting. So we do hope on a lot of interaction. You can use the chat function, you can raise hands. We will do our best to make sure that all your questions and suggestions are taken into account. And do note we have 2 sessions with breakout groups in the afternoon, today and tomorrow. So we also would appreciate very much if you would join that sessions and give your input in the discussions, because it will help us a lot. I prepared a few slides. I think I still have 7 minutes, so I'll not go into too much detail. I think most of you know our board, but just to give you a brief overview for those who do not. So the HPV Prevention and Control Board, the mission is to generate and multiply and disseminate relevant information on HPV to a broad area of stakeholders, thereby contributing to the control of HPV infection and to the prevention and screening of HPV-related cancers. So we want to provide evidence-based guidance on key technical and strategic issues, and also help to monitor progress of HPV control programs at the country and regional level. So we have a multidisciplinary group of experts, advisors and observers. They all act in their personal capacity. They are often affiliated with stakeholding partners. We do strive to have open and honest discussions. We are not reimbursing our advisors or speakers only for travel-related costs. And we are not a real formal organization, so we don't have any bureaucratic structure, nor a president or a vice president. And our observers are of several different organizations. I'm not going into detail. You can find also the list of our advisors at our website, but we do try to have people from the academic field, also from the public health field, and also have observers from international organizations. So trying to have a lot of stakeholders together. We also have a dedicated secretariat with a number of people involved. So in total, we think that it will take about 2 full-time equivalents to run our activities during 1 year. So we prepare and organize the meetings, but we also assure that the output is published in peer-reviewed journals if possible. We also support media activity. We maintain our website. We are participating in third-party meetings. And I think also important, we do get funding from private industry, but all financial issues are dealt with according to the rules of our university. This is our website. It has been renewed recently, and this is because it's embedded in the university website, and the university decided to change their layout. It doesn't look as nice as it used to be honest, and that's my personal opinion. But the big advantage is that it is a smartphone-friendly website, and I think if you use it on your smartphone, it is really nice to use it. Just a brief overview of the meetings we had already. So we started with this board in 2015, and we had our first kickoff meeting here in Antwerp. Our first real meeting was on barriers in HPV vaccination and cervical screening programs in 2016. Then we had our first country meeting in Denmark in 2016. And we had a technical meeting which was organized together with the London School on building trust, managing risks, vaccine confidence, and human papillomavirus vaccination. After that, we had a country meeting where we combined Ireland and the UK. That was in 2017. And we had the Minister of Health at that time opening our meeting. We had a meeting on the role of healthcare workers in HPV vaccination and screening programs, which we organized in Romania. And then in 2018, we had a meeting in Colombia, and you will get some more information on that during the first session. Subsequently, we had a meeting on HPV vaccination of adults in 2019 in Antwerp. And then in August 2020, we had a meeting on the challenges in HPV screening landscape, triage of screening, positive samples, and screening in the area of vaccination. This was also done due to the fact that we could not travel anymore in Antwerp, as was the subsequent meeting where we looked at the impact of COVID-19 on cervical cancer screening, treatment, and vaccination. So on our website, you will find also short videos of specific speakers, and also if speakers allow, and we are very thankful that most of the speakers do, these videos or presentations are also available on our website, and you can find them on YouTube. And I was very pleased to receive an email last week from Noel Brewer saying that the roundtable on HPV prevention in the US also added us as a playlist on their YouTube channel. So also there, by sharing a number of the presentations that we produced during our meetings. We also, as I said, have tried to have output of our meetings in peer-reviewed journals. So this is an overview of what we have achieved up to now. So we had our first meeting was on overcoming barriers in HPV vaccination and screening programs. And this was published in Papillomavirus Research, which the journal unfortunately doesn't exist anymore. We also had a kind of combination of the different country meetings where we looked at sustainability and resilience, and this was summarized in a paper in Vaccine. We have the role of the healthcare provider in HPV vaccination programs, which again was published in Papillomavirus Research. And then recently, last year, we published the outcome of our Colombian meeting in BMC proceedings. And Mario will discuss tomorrow on the impact of COVID-19 pandemic on human papillomavirus-based testing services to support cervical cancer screening, which was also recently published. So I just want to point to the background document. So this is a kind of pre-meeting draft. I think all of you received it. It contains information on the different topics. So NIAP did a screening of the peer-reviewed literature in PubMed to check for any recent publications, and you will find these together with the abstract in the document. A second section contains a number of publications relevant to this meeting, and please, if you have other documents which you think are relevant, we can add that for the final document that we will put on the website. Currently, I think we have the 2 reports on the Colombian meeting. We have the one that is in the BMC proceedings. We have also Xavier Bosch made a special article on HPV World, which we included, and also the paper on the impact of COVID testing on HPV testing is fully included. And additionally, we also ask our speakers to give a number of relevant articles, and these lists are also in this background document. So then we come to the meeting of today and tomorrow, reinforcing HPV vaccination and cervical cancer screening and treatment. The objectives, and I think you kind of noticed today, the talks will more focus on vaccination. Tomorrow, most presentations will deal on screening and treatment. But tomorrow afternoon, the breakout groups again will deal, one group will deal on screening and one group will deal on vaccination. So to increase access of vaccination, we want to discuss experiences and opportunities to sustain, reinforce, implement HPV vaccination in different regions across the world in general, and also during the COVID-19 pandemic. We want to discuss innovations that may help to achieve access targets, such as improved vaccination schedules, single dose training and communication of healthcare workers. We also want to review successful country examples with increased access to vaccination and high vaccination coverage, discuss the need for future research and trials, and also discuss lessons learned from COVID-19 and how these opportunities can be leveraged to increase access to vaccination. Regarding cervical cancer screening and treatment, I think the same. We want to discuss experiences and opportunities to sustain, reinforce, and implement screening and treatment programs across different regions in the world. We want to discuss innovations that may help to achieve access targets, such as self-sampling, availability of HPV tests, point of care, screening technology, artificially intelligence-based screening, and digital reaching out to women. Review successful country examples with increased access to screening and treatment. Again, also discuss in this field the need for future research and trials, and discuss lessons learned for COVID-19 and how to leverage these opportunities to increase access to cervical cancer and screening. So thereby, I thank you already for your attention, and I'm very happy to announce the first session of our meeting today, and to hand over the floor to our chairpersons, Suzanne Garland and Ludmila Mosina.